Deputy President David Mabuza has urged men to get tested for HIV and implored those who test positive to enroll for ARVs. Mabuza says this will help HIV-positive people live longer and limit transmission of the virus. He was giving the keynote address at the main World Day AIDS commemoration at the village in Limpopo yesterday. Newzroom Afrika's Pelane Phakgadi was there.
The Deputy President and his entourage arrived at Xikundu, going door to door to raise awareness about HIV and AIDS. Deputy Chairperson of the South African National AIDS Council, Steve Litzeke, says men are the least interested in knowing their status. Litzeke adds that this is one of the reasons the Vembe district here in Limpopo is one of the highest in transmission of HIV. This year's theme is working together to end inequalities, AIDS, TB and COVID-19, get tested, get vaccinated, adhere to treatment.
Of course, men have always had a low health-seeking behavior, and one of the biggest work that the men's sector has been trying to change around social behavior change, conversation around gender-based violence, testing, healthy lifestyle, and those are the priorities we have incorporated in our national strategic plan.
John Brantford is the South African Director of Centers for Disease Control and Prevention, an American public health agency. He says on this World AIDS Day, the message for enrolling for antiretrovirus for those infected by the HIV virus is essential in clamping down on new infections.
So what that means is that people living with HIV now have really good news. So not only do they extend their life, not only do they live a healthy life, but they're actually able to be confident that they can't put anyone else at risk. So they can have normal lives, right? So they can conceive children just as anyone else can. They can raise families, they can date. And what we've learned is that, for someone who's older like myself, being offered the opportunity to have a long and healthy life is very important. For someone who's in their 20s or 30s, that may not be such an important message for them, but to learn that if they get on treatment, if they learn their status and get on treatment, they can achieve an undetectable status, U equals U. That means that they can't transmit the virus to anyone else. So they don't have to worry about dating. They don't have to worry about being HIV positive anymore.
Deputy Social Development Minister Henrietta Zulu says the Vembe district has the highest number in South Africa as far as girls between the ages of 9 and 14 giving birth. She says men in traditional leadership should be instrumental in dealing with statutory rape, as more young girls are infected with HIV, but not boys in this age group. Zulu says older men should also take responsibility to protect the girl child.
Child pregnancies are very high in this district. The highest 9 to 14-year-old girls that have children are found in this. At 14, they are having their second child. And by law, all of that is statutory rape. It also shows the high prevalence of HIV and the lack of the use of protection. So we here, as we celebrate World AIDS Day, acknowledging the fact that children become mothers when they are still children, which has a direct economic challenge, because children that are raised by children are not necessarily going to be able to contribute.
Deputy President David Mabuza gave the main speech at the local stadium. He said an estimated 3.6 million people in the country lost their lives due to AIDS-related illnesses in the period between 1985 and 2020.
When those who have tested positive take antiretroviral properly, this will improve the quality of their life, thereby ensuring that one enjoys a lifespan that is similar to that of an HIV negative person, especially if you start treatment early enough.
In the June 2021 United Nations Political Declaration on HIV and AIDS, the world leaders expressed concern that in sub-Saharan Africa, 5 out of 6 new infections among adolescents aged between 15 and 19 years are among girls, and that adolescent girls and young women aged between 15 and 24 account for 24% of HIV infections. That is despite them representing about 10% of the population.